Hello, good morning, and thank you for the opportunity to be here today to present the results of our recently launched white paper, Multiple Myeloma in Central Europe and the Baltics, supporting early and equitable access to care to improve patient outcomes. So briefly, to give you an overview of our approach to the research, we took a holistic look at the challenge of multiple myeloma in 10 countries in the Central Europe and Baltics region. By holistic look, we want to look across the care pathway at challenges that our patients are presented with, that the growing burden represents, but also opportunities to improve and drive better care. The approach for our research involved an in-depth literature review to understand what is known and published on the burden of multiple myeloma, the health, the economic aspects, the growing patient complications, what guidelines are in place to provide care to patients. And once we've done the literature review, we then want to speak to experts. So there's only so much information you can get from published literature. You want to get the nuance and the key information from people on the ground who are dealing with multiple myeloma. So we spoke with hematologists and patient advocates across the region. But as mentioned, it's a holistic look, so we wanted to speak to those experts, but then also health economists and policy experts, so we could situate multiple myeloma within the wider healthcare system. So once we'd conducted our literature review, we spoke to 23 experts across one-on-one in-depth interviews or an expert panel meeting, and then we brought the findings together, which are published in our white paper report, and I'll walk you through our findings. As mentioned, it was 10 countries that were a focus for the study, with Croatia being one of those. Multiple myeloma is a blood cancer, the second most common blood cancer, accounting for 10% of blood cancers globally and almost 15% of cases in the Western world. There's currently no cure for multiple myeloma, and patients experience multiple relapses. And with each reoccurrence, they have fewer treatment options available. So the findings from our research, so looking at data from the last 30 years, we can see that the incidence rate in Central and Eastern Europe is above the global average. And between 1990 and 2019, there was a 37% and 42% increase in the standard incidence rate in Central and Eastern Europe. So that's looking at data from the last 30 years. When we look forward, roughly the next 30 years, up to 2050, looking specifically at patients aged 60 to 85, we can see Croatia, the estimated number of patients in 2022 was 335, and that's going to increase to 392, a 17% increase. I think, as we'll hear from the presentation and the discussion later, there's a lot of challenges in dealing with the current number of patients. Given that it's going to increase by almost a fifth, it's going to present a wider challenge for the health system, that the health system needs to adapt to match this growing burden. But also, in saying that, you see the number of patients here, and this is the number of new cases that will present each year. It's much smaller than a lot of other diseases. So theoretically, it should also be more manageable to deal with this number of patients. The bright light in multiple myeloma is the progress that's been seen in the last 2 decades, with the explosion of novel therapies dramatically improving patient outcomes. So the survival of patients with relapsed disease has almost doubled, and that of newly diagnosed patients has increased by about 50% following the introduction of novel agents. The median overall survival of patients has increased from 3 years in the year 2000 to almost 10 years at present. The improvement in the overall in survival from myeloma is actually greater than any oncology area. So there's been a lot of improvements in oncology and increased survival rates, but the greatest progress and improvements has been made in myeloma care as a result of the innovation in the area. However, this improvement hasn't been felt universally. So real-world evidence shows that there's been significant differences in clinical care for multiple myeloma between Western and Central and Eastern European countries. Mortality rates due to myeloma continue to be higher in Central and Eastern Europe as compared to Western, suggesting differences in the rollout and improvements that have been seen in the diagnosis and access to treatment. There are a number of challenges that patients and myeloma faces. One of them is related to the awareness. So awareness both at the level of patients, but also healthcare professionals. So from a survey conducted European-wide, over half of patients waited 3 months before seeking medical help for their symptoms, indicating awareness challenges in the general population. But also it's the nature of multiple myeloma, given that it's back pain and fatigue, which are common symptoms that mimic other conditions, which again highlights a challenge with multiple myeloma. Over a fifth of patients seen multiple doctors before they received the diagnosis, highlighting some challenges in awareness among healthcare professionals. Again, there are challenges of these symptoms. Almost 10% of patients were only diagnosed when they presented to the emergency room. So they presented perhaps with renal failure or another serious complication. It was only at that point they were told, you also have a blood cancer. So that really highlights the challenges that patients face and to end up in that tough position. So delayed diagnosis is a costly problem, and it's a big problem in the Central Europe and Baltics region. Delayed diagnosis results in complications and patients that are more difficult to treat, have fewer options to receive, and experience a much greater health and economic burden from the condition. So in a survey of European countries, the estimated median time from when your symptoms developed to when you were diagnosed was 3 months in Ireland, Italy, and Belgium, while in Bulgaria and Slovakia it was estimated to be between 6 and 12 months. We don't have data specifically from Croatia, but maybe some of our experts are aware of the time for that. But one aspect that is one of the challenges in multiple myeloma is getting stakeholders to work together, and we can see that patient advocates and people within Croatia are very active, and Mijelom, I'm not going to pronounce that correct, but the myeloma patient advocacy group here, who we'll hear from Mira later, they initiated a national prevention of late diagnosis prevention program. And this was supported and really took the interaction and the collaboration of multiple stakeholders, professional associations, hematologists and GPs. And this is one thing that is key, that is needed to addressing many of the challenges of multiple myeloma, but it's this cross-stakeholder engagement. Mira told us that the effort resulted in a tool aimed at primary care to help healthcare professionals in early diagnosis of multiple myeloma. I think she'll give a better description of it later on, but the idea of having it in specialities and settings such as physiotherapy and nephrology, where patients are presenting but they're not diagnosed. So having this greater awareness among other healthcare professionals to diagnose the disease where it's not often not often recognized and at that early stage is key. A key challenge for multiple myeloma is the inadequate investment in healthcare. So healthcare spending as a percentage of GDP in the Central Europe and Baltics region is lower than Western Europe. For one example here, the UK equals 10.3%, significantly higher than the 6.9% spent in Croatia. And in saying that, that's comparing perhaps against the UK. The EU average is also 10%. In fact, the EU average was 10% in 2014. And it's increased to almost 11%. So you can kind of see the gulf there in the spending levels and the investment in healthcare in Croatia. The Central Europe and Baltics region lags behind Western Europe in access to oncology drugs across the board. So from a study of multiple cancers, you had access in Western Europe, you had access in Central and Eastern Europe, and for multiple myeloma, the access was greater the difference was greater and worse for multiple myeloma. Highlighting the inadequacies and the inequalities for patients with multiple myeloma in the region. There's a low availability of optimal treatments in Central Europe and the Baltics region. So this table has information on the recommended treatments. So based on the best available evidence synthesized in a guideline, what patients should be receiving, whether they're eligible for a transplant or ineligible, and the 3 treatment options. And we can see N stands for not available in the public system, Y for yes it is, and then it's a comparison between Central Europe and the Baltics region and the EU 5 countries to give a comparison. 3 weeks ago that would have looked a little bit different for Croatia because there's two new therapies that have been added to that list, but you get the general picture of how the Central Europe and Baltics region is comparing to other parts of Europe, and that there is a great difference in level of access to treatments. And also, I think another chart which would have been good to include is also the delay in Those treatments are now available in Croatia, or more of them, but the difference compared to other countries, it's happening 2 and 3 years later. So one of the challenges with health technology assessments and reimbursement decisions is said that they're inflexible, and they don't take account other factors. They rely solely on cost effectiveness analysis. So one health economist in the region told us that current HTA systems fail to account for all aspects of quality of life, such as social impact, social expenses, and changes in economic productivity. All very difficult things to measure, but all things that need to be considered in the wider value and benefit of treatments. There's also very poor access to holistic care across the region. So given the many manifestations of multiple myeloma and how it impacts different organs, strong multidisciplinary care is essential for improving outcomes. But this is lacking across the region with a big gap in palliative care. I did know from our report that the gap in palliative care, there has been some progress in palliative care policies in Croatia and an increase in the number of beds that are available for that. But at the same time, we've heard from experts in the region that it's still insufficient to deal with the current number of patients that need this key aspect of multidisciplinary care. Survivorship issues also need more attention, especially among an emerging cohort of younger adults who face unique challenges such as re-entering the workforce. And as mentioned earlier, while multiple myeloma is often seen as a disease of the elderly, 37% of patients are diagnosed with the condition below the age of 65. Over 3,000 clinical trials have been conducted in multiple myeloma over the last 2 decades, but only 6% of them have included patients from Central and Eastern Europe, highlighting another key inequality in the region. There are a number of barriers that impact patients' access to clinical trials. These include a shortfall in trained workforce that can manage the clinical trial, the data that comes with it, not having access to the recommended therapy. So if a therapy wants to go to trial, it needs to be compared against standard care. But if standard care isn't available in that country, it means the trial won't be run in that country. There's also a lack of collaboration between countries in the EU and barriers for pharma companies in the region in terms of bureaucracy, but also a lower number of patients for certain conditions. So there are a number of challenges that are summarized here. The number of patients with multiple myeloma has increased, and it will continue to increase. So it's increased in the last 30 years, and it's going to continue to increase. Delayed diagnosis is a significant problem. It increases morbidity, disability, mortality, and healthcare costs. Existing policies and inadequate investment in care create barriers to accessing the best available care. So how decisions, inadequate investment in the healthcare system that could strengthen the whole wider healthcare system and pathway for patients with multiple myeloma and other conditions is lacking, but then also policies that are making decisions about access to treatments is holding back what we know are better treatments for patients. But also policy experts and people that are making the decisions, they are restricted or they have limited access to the best available data to guide evidence-based policy making. So that's something that needs to be improved and that they need. And there's a great lack of access to clinical trials in the region. The path forward in overcoming these challenges requires multiple actions. We need to facilitate early diagnosis and specialist evaluations, invest in strengthening the healthcare system, improve the patient care pathway for multiple myeloma and multiple conditions. So moving and increasing that investment from 6.9% up towards the EU average will have benefits for patients with multiple myeloma, which is the focus of today, but it will also have multiple benefits for patients across the healthcare system who need care now and into the future. We need to improve access to innovation. So we need to look at how HTA decisions are being made. That's going to also change with the new HTA legislation coming in across the EU, but we need to look at current decision makings, how they're being made, how they're going to be adapted to this new EU regulation. We need to enhance estimates of the burden of multiple myeloma and the impact of comprehensive care. So there's very limited understanding of the true burden of multiple myeloma, the costs of care, the costs of complications, and the benefit of the treatment. So if there was better registries and better data collection, It would make it easier for policymakers to provide evidence or to deliver on evidence-based decisions, and it would make it easier for everyone that's fighting for better care to illustrate the impact of this better care. And we need to strengthen stakeholder collaboration towards delivery of high quality care. So we need to enhance how stakeholders across the healthcare ecosystem, healthcare policymakers, finance ministers, pharmaceutical companies, patient advocates, hematologists and GPs working together to deliver optimal access to clinical trial, to better care for patients and better outcome for patients. Thank you for your time.
Hvala vama.